Conneaut has a new veterinary clinic at the one-time branch of Conneaut Savings Bank, fronting the Conneaut Plaza on West Main Road. It's called the Conneaut Creek Veterinary Clinic. It has a full-time veterinarian, Stephanie Gildersleeve, and even an office manager, Baby. Oh, and Baby bites.
This is our new facility, and as most of you local residents know, this at one time was the Conneaut Savings Bank. And when you came into this area here, it was the bank lobby, and the teller counter was over here with the tellers behind that by the drive-up window. And what we've done is we've taken out the teller counter and added 2 exam rooms here and used the bank lobby then as our waiting area. And then through this door, we'll show you here in a little bit, is a treatment area and a surgery area in that part of the building. The demolition and rebuild process went very, very smoothly as far as those things go. Of course, there's always some hold-ups and problems, but we got the whole project completed on schedule, and it took about 2 months. And I want to thank the community and the city of Conneaut for the incredible support that they have given me throughout this project. The city of Conneaut has been very welcoming, very helpful in this project. The Ashtabula County Building Department has been. The Conneaut Telephone Company is phenomenal. They've been wonderful to work with. Everybody that has been a part of it has made this project very, very pleasant. I've looked at Conneaut for a number of years as far as the need for veterinary service. And as most people know, I have 2 other veterinary clinics, one in Jefferson, the Country Doctor Veterinary Clinic, and one in Geneva, the Geneva Veterinary Clinic. And I've been in practice in the county for about 40 years. The Conneaut area was an area that was in need. It was underserved from a veterinary standpoint. Dr. Drost has done a wonderful job for Conneaut for many, many, many years. He's an excellent veterinarian, very talented man, and he is beginning to slow down now at this point, which is certainly his right to do so at the long tenure that he's had in the veterinary profession. So with that being said, we knew that there was a need here in Conneaut, and we're glad to fulfill it. We have 2 exam rooms, and what you're seeing here is one of them. We have the exam table here. The clients will enter in from where you're looking at me, and then back in here is our laboratory area. And you can see that we've kept the bank teller cabinets, and we're using that as a supply storage and medication storage area. The barn siding that you see up on the wall there is just a real nice touch. It's throughout the building. That's reclaimed barn wood that we've used, and it brings a real warm, homey feeling for both the animals and the people. This chart on the wall is an acupuncture chart.
So you're like the resident doctor here, correct?
Yes.
And I understand that acupuncture is a specialty of yours. So can you talk about that just a little bit? In what circumstances would a pet benefit from the acupuncture?
Sure. I mean, acupuncture can be used for almost anything. Most people know acupuncture to help out with musculoskeletal problems, so, back pain, arthritis, just pain, muscle pain, that type of thing is usually what a lot of people go for acupuncture. It can also, help with stress symptoms, it can help with heart, it can help with, liver, endocrine. There's a lot of different areas where acupuncture can be used in conjunction with other medicine, possibly herbal medication or just medicine that, a vet would prescribe. So it can just be a nice little add-on with a lot of things like that. And it can also be, with pain, you might be able to do more acupuncture and then get a lower dose of the pain medicine when you do acupuncture.
What about dogs that are hyper? Do they relax under this? Do they take
Some of them do, yeah. A lot of times when you do poke them with the needles, they will relax. They'll take a little nap, during the 30 minutes that the needles will be in the skin. And the needles themselves don't really hurt very much when they go in. There can be times when you have a very sensitive point, So it hurts on the initial poke, but then it does have that nice effect where it's like, oh, you know, all that tension is just being released from the body. So I would say a lot of animals do respond well to having the needles placed in their skin. Yeah, and you know, some animals will be pretty hyper and you may only be able to stick it in and then it comes right back out, but that'll still have some effect, you know, even with just having it in for a few seconds.
The practices, there's different types of medicine, and Dr. Stephanie just spoke about acupuncture, which is a non-traditional type of treatment. And we're real excited to have Dr. Stephanie as a part of our 5-doctor team, because she can bring that modality along with allopathic medicine. Allopathic is what we would consider normal medicine, pills and liquids and injections and surgery and things like that. But total health is often a balance of traditional allopathic medicine along with alternative treatments like acupuncture.
Is that a major change since you started 40 years ago? Is these expansions into other kinds of treatments?
Oh, absolutely. 40 years ago, that wasn't even heard of in veterinary medicine. And I've seen so much change in my career, and it's been very exciting change to watch. With the new modalities that have come in, new medications, new surgical procedures, new diagnostic equipment, the technology has elevated veterinary medicine where we're very, very comparable to human medicine today in our ability to diagnose and treat.
Keep animals alive longer?
Much longer. You know, I get that question quite a lot anymore, and I can say that the lifespan for many pets has almost doubled. Not quite. It's probably increased by at least 75% since I started 40 years ago. For example, 40 years ago, if somebody would come in with a Labrador Retriever puppy and say, well, gosh, Doc, how long do you think this dog will live? I'd have told him, oh, maybe 10, 12 years. And now we're seeing Labrador Retrievers 16, 17 years old. And I see that with all breeds and all species. And that's due to the great care that people are giving their pets. Dogs aren't chained out behind the house to the tree or to the doghouse anymore. They're living inside. There's real high quality veterinary care available. There's amazing vaccines available and great pet foods available. So all of those things combined together have increased the quantity and quality of life for pets.
I've always been interested in other treatments that you can do besides just medicine. I think that your body is an amazing machine, and if you help the body help itself, you know, I think that's where I got interested, that it's just another technique you can do when maybe medicine isn't working all the way. You know, possibly try acupuncture or possibly try herbal medicines or, you know, other treatments. I mean, there's plenty of holistic treatments out there other than just acupuncture, but acupuncture is one area, you know, that I decided to go for.
Well, veterinary medicine for me was the perfect combination of my love for animals and my love for science. So it allowed me to combine those two things and make a career out of it. I've been doing this for almost 40 years now and really enjoy it. I'm at an age where people say, well, aren't you retiring soon? And I certainly could, but I have so much joy from what I do that no, I'm not going to retire soon.
And I also another office at a time that you retire doesn't make a whole lot of sense.
No, and it pretty well ensures that I will not be retiring. My role in the veterinary clinics that I own is owner-manager is the biggest part of my responsibility. I do see patients and clients at the Jefferson Clinic about a day and a half a week, and I'll fill in at the other clinics on an as-needed basis. But the majority of my time is spent on management. And our practices are focused on wellness and keeping the pets healthy. That goes back to my roots. When I first started practicing, I was a dairy veterinarian. And I worked on dairy cattle almost exclusively, and some horses mixed in with that. And as a dairy veterinarian, your job is to keep those cows healthy. Sick cows don't make milk, and if they're not making milk, they don't make money. So all of the emphasis was on wellness, and we've carried that emphasis over into our small animal practices. We don't like to think of ourselves as salesmen. We do have the Purina product line here, the Purina prescription products. There's certain diseases that are treated with nutrition, just like in people. Diabetic pet requires a special diet. Pet with liver disease or heart disease requires special diets. So we do carry those special types of diets. We do have some supplements and so forth for those pets that need them. Primarily what we're focused on is providing service and information. The word physician means teacher, and we take that very, very seriously. We want to teach our clients how they can be better caregivers for their pets. So we spend a lot of time with each client when they come in for a visit. And we do a whole body exam from the tip of the nose to the tip of the tail. Yes, let me share this one story with you. One of the most interesting stories in my practice career was the very first police canine that the Ashtabula County Sheriff's Department had. And in order to be certified by the state of Ohio as a police canine, all of their teeth have to be intact. And this dog had broken 2 of his fang teeth. And those are the teeth that are used to hold on with. So he couldn't be certified. And at the time when this happened, there was no such thing as veterinary dentist or veterinary dental specialist. So I talked to the local dentist in Jefferson, and he and I together put caps on this dog's teeth. We did it in the dental office. I did the anesthesia. He did the root canals and the caps, and it turned out fabulous. The dog was black and silver German Shepherd, and we put stainless steel caps on his canine teeth, which are the fang teeth, and it was impressive when he was styling. He was styling. He was styling when he was put on the aggressive command, and his lips would go back. I mean, he looked like a bionic dog. Going back 40 years, when I was in my veterinary training, we did not talk about oral health or dental health. Basically, they taught us how many teeth each species of animal had, and that was about the end of that story. But as pets have become an integral part of our family, and we consider them family members, we want them to have as long a lifespan and a high quality life as possible. Taking care of their mouth is a critical part of that. Research has shown us that dental disease will take 2 years off your pet's life. Now, when you're talking about an animal that's only going to live maybe 10 to 15 years, and you take 2 years away, you've robbed them of 20% of their lifespan. And you know, this should come as no surprise. Our own dentists have been telling us for years the importance of regular dental cleanings, controlling gingivitis, controlling periodontal disease, and the effects that it has on our heart valves, our liver, and our kidneys. Exactly the same thing with pets. And a lot of times I'll have people say, well, you know, Doc, we never used to clean our dog's teeth. Well, yeah, I do know that, and I remember those days. But now it's important because your dog's living in your house with you, and you want this dog to live as long as possible.
And pain-free.
And pain-free.
Yeah.
And you know, and that's a good point that you bring up, because when we get into these really diseased mouths and clean them up and do the work that needs to be done, I can guarantee you that when that dog or cat comes back in 2 weeks for a reevaluation, the client is going to say to me, wow, I cannot believe how good they feel. They're playing with their toys, they're interacting with us, they're doing things they haven't done in years. Yeah, a toothache is a toothache, whether you're a dog or a person. And the other thing that people often say to me is, well, you know, if their mouth hurts, why do they keep eating? Well, animals are survivors. They have to eat, and they know they have to eat whether they have a toothache or not. I would like to talk about this clinic. Our Conneaut Creek Veterinary Clinic is an outpatient clinic. So here we can take care of all of the wellness needs and all of the outpatient care that your pets need. General surgeries like spays, neuters, declaws, those types of things will be done here as well. Teeth cleaning will be done at this clinic. But major medical, major surgical cases will be referred to the Jefferson Clinic or the Geneva Veterinary Clinic. And the reason for that is at those clinics we have much more space, we have more equipment, and we have more staffing, so that those major medical, major surgical cases then can have the level of care that they need at those clinics that we're not able to provide here. And it's simply a limitation of physical space here. And it makes no sense to duplicate expensive equipment. A digital radiograph machine, easily $60,000 to $75,000 if you buy a cheap one. And I have got one in Jefferson, I've got one in Geneva. It doesn't make much sense to put another one here right now and duplicate that expense and then pass it on to the clients.
You're talking about space in Conneaut, and you've been looking at Conneaut for a while.
For years I have been looking at Conneaut. And it was surprising to me that how difficult it was to find a space that had the exposure that I needed on the proper road, the proper drive-by exposure, a facility that could adapt to a veterinary clinic. Very difficult to find, very difficult to find. So, well, I drove by this one day and I saw the for sale sign. I turned around, came back, wrote down the phone number, and here we are today. Yeah. And I love Conneaut. Conneaut, I think, is just has such a tremendous opportunity to prosper. The harbor, the township park, that Conneaut Township Park is the most beautiful township park, the most beautiful park, period, on Ohio's lakefront. It's gorgeous. The Conneaut Creek is just an amazing natural resource. There's a lot of things here that I think are just incredible.